everyone, my name is ZEAHLOT Lopez. I'm a licensed marriage family therapist in the state of California, and I am super excited for you guys to be watching this video today because that means that you're either looking for mental health services, you have a loved one that needs mental health services, or you are educating yourself on how to better help others and or yourself. So today, as a follow-up to a presentation I'm doing on the Department of Mental Health and what resources we have in LA County and just what's out there to help you with mental health, I do want to have some follow-ups on resources. So the first thing I want to talk about is how do you even access resources through the Department of Mental Health? So the best place to start is either one on their website or you want to call them. And calling actually is the best request because there's options for languages, but there's also options of who to speak to specifically, right? So I'm going to go ahead and give you that number. And the beautiful thing is that if you have a pen and paper, you have your phone, you could just jot it down, or you could even pass along this video to somebody that might need it. So the number for the DMH access line is 1-800-854-7771. I'll repeat that. That's 1-800-854-7771. And the beautiful thing about this is they have an option for Spanish. So for those that are Spanish speaking, please feel free to call. I'll also be making this video in Spanish for those that are monolingual in that language as well. Let's say that you call in and your child has some type of autism or they have some type of learning disability or long life disability, right? It's possible that the Department of Mental Health and their resources for mental health may not fully meet what that person may need, whether it be a child or an older adult. So it's best to collaborate with the regional center. What's that? The regional center is a center dedicated to helping others with lifelong disabilities or disorders. So the best number for them is 213-744-7000. Once again, that's 213-744-7000. So that's 7,000 at the end. And it's the LA Regional Center. So as well, they have options for Spanish, they have options for different languages, but what's important is that the person gets the help they need adequately, right? And it's a beautiful thing. They might be able to provide services in the home, in the school setting, or the office. So they're definitely flexible. Please learn what it is that they have available for you. Lastly, I want to give two options for those that are looking for mental health within their community, right? So the best place to look around is for agencies that take Medi-Cal and they are looking to work with the community, right? Especially in communities of color. So these would include any agencies that provide services, and they could do it weekly or bi-weekly or whatever it is that works for you as well as for them, because they usually are pretty packed. Most agencies will have what they call a wait list because there are a lot of people trying to get in. But the good news is that if you're very dedicated and you're like, hey, I'll be willing to wait, just put me on the wait list, it goes pretty quickly. I'm pretty sure, due to the fact that I worked in an agency, that their wait list cannot go past 3 months. So in some circumstances, it does move much quicker than that, and they might be able to get you in a couple weeks or, a month. But for others, it might take a while. So patience is the key here. Now, once you go ahead and get on the wait list and they call you for what they call an intake appointment, that's super important because that's where they're going to ask you what's happening and what is going on. That's where you're going to describe your symptoms and how whatever's going on is impacting your life. So symptoms would include poor appetite, I'm not really hungry, I can't sleep, 5 out of 7 days out of the week, I have insomnia, I'm not able to do things I was able to do, I have a lack of concentration, things of that sort, right? And then impairments means not able to function at work, not able to clock in on time, I'm being late to work, things of those sort. So they'll go ahead and do that with you. They'll also ask you for documentation of who the person receiving services is, right? And after that, then you'll be assigned a therapist. Some agencies, the intake is done by the therapist, and other agencies, it's not. It's a separate person. So just know that they do work as a team collaboratively, and we're here to help you, right? So lastly, I will leave a resource for those that actually have insurance such as Kaiser, Cigna, Blue Cross, of that sort. It's more of a private sector. For those, and if you're looking for somebody within your network, in-network means that somebody wants to have that covered by their insurance and then they pay the copay. This would include looking and searching for a therapist. A great resource that you can use to see who is in your network and who is covered is psychologytoday.com. I'll repeat that. That's psychologytoday.com. And the beautiful thing about this is that you can actually try and find a provider of mental health services, a therapist, by zip code. So let's say you put in the zip code in the search bar, right? And you'll get a whole bunch of search of a list of therapists. So from there, you can actually filter it on the left side by gender. Let's say you want a male therapist. Let's say you want a female. Check that, right? Let's say you have Blue Cross, you have Kaiser. Click Kaiser or click Blue Cross. And it filters it even further, which is wonderful because it breaks down your time really. After filtering everything that it is you're looking for, even specialties, maybe you're looking for somebody that specializes in anxiety or loss or grief and loss. You can check those boxes too. The list becomes smaller and smaller, and thereafter you're able to call them with much more ease and less anxiety. And when you call them, make sure to leave your name and number twice, just because we get a lot of phone calls when patients try and call to get in, right? So once again, I hope this was helpful. And the last golden nugget that I'll leave you is that if and when you are looking for services for a minor, a child, please ask the school they attend to see if they have a list of resources for mental health, as far as agencies, as far as where do they refer these kids to, right? The school is much more helpful than we believe. And the office usually has a list of resources, so please utilize those, and thank you once again for watching. And if you'd like, I have other videos that might be of help to you, so please feel free to watch. Thank you.